You are live.
Hello everyone, I am Dr. Vidal and we are back with Tuesday Tips. Thank you so much for joining every week. We go over different topics in plastic surgery and I get to answer your questions. Today we're going to be talking about the other part of preparation for mommy makeover and tummy tuck, because last week we talked about the post-op, how to prepare for your post-op, especially those first 2 weeks. So how to prepare before coming in, or what things you have to do before coming in for every patient that comes for my makeover, to have it. So a lot of patients are like, okay, I booked for a year from now. When do I need to start doing my workups? When do I need to do this and that? So we'll go over all of that so you can have a little bit of a overview of the process. So basically everything starts within 60 days before the surgery. Before 60 days, what can you do to prepare? Educate yourself, join our lives, get your questions answered. Establish a good plan of exercise and diet that can be sustainable for you. Don't go crazy on juicing and then you can't sustain that weight. Try to modify your life, right? This is a big investment in your body. So try to create that plan that works for you and that you can take it long term afterwards, so you can keep those results long term, right? And that's all before the 60 days. At 60 days is when all the initial planning and submitting of stuff will begin. If you do any of this before those 60 days, we'll have to repeat stuff, okay? So that's why it's not great to do any of this before the 60 days. What can you do before the 60 days? Get your appointments, because we live in a society that nowadays you call for an appointment and it's 30 days, 6 weeks from now. So I don't want you to wait 60 days and then call for your primary care appointment and it's like, oh, we don't have an appointment for 2 months, right? But do all that planning for within 60 days. So what do you need for your medical clearance? A medical clearance is your primary care physician. But Dr. Vidal, you're the doctor, why don't you clear me? Well, majority of my patients come from out of state, and I don't know your medical history like your primary care physician. Oh, but I never go to a primary care. Then you should. You should before your surgery, because they look at you a different way than me as a surgeon looks at you. I'm going to focus in the surgical part, and that if you're clear for the surgical part. But a primary care physician will look at you in a medical way, which means he's going to rule out other conditions that I'm not going to be looking out for, okay? Diabetes, high blood pressure, cholesterol. Make sure that you are healthy in all those other ways. He's going to ask questions about your lung capacity, your cardiac capacity, and all the things that are going to be super important to determine if you can tolerate general anesthesia. So that is why you need an internal medicine, family medicine practitioner, a primary care physician to overlook everything. In some Latin cultures, especially Puerto Ricans, and I know other Latin cultures, like to go to specialists all the time. I tell this to my parents, I tell this to everyone. If your car gets messed up, you go to a tire guy, you go to the guy of the gas, but you need someone to look at the car as a whole, and that is why a primary care physician is so important. We all should be going to a primary care physician and not only the specialists, okay? So what do I need as a pre-op lab? The primary care physician may do more blood work depending on what he asks you on your past medical conditions, to check other things, right? And that's why you should go to your primary care. But what are the labs that I require for your surgery and for the anesthesia? CBC, okay, that's the basic. It's going to give me your white count, it's going to give you your hemoglobin, it's going to give you your platelets, okay? That's what I'm looking for there. Hemoglobin should be 12 and above. I do accept, for example, mommy makeovers, tummy tucks with 11 of hemoglobin, but for BBL lipo cases, you should have at least 12. There's more bleeding involved in lipo BBL cases than mommy makeovers, and that is why your hemoglobin should be higher, okay? So a CBC, a CMP, that gives me electrolytes, that gives me your kidney function, your liver function, it gives your sugar, your coagulation studies. This is one of the most important ones, and it's actually 2 different tests The PT-INR comes together, but the PTT is separate. I put it all together because it's under the same umbrella, but it needs to be ordered as two different tests, PT-INR and PTT. The HIV is extremely important because we have to do a deep cleaning of the operating room if you are HIV positive, and we have to be more careful with the instruments and put your case at last of the day, just to protect everyone. It's not because I don't do HIV cases, but it's because we have to take extra steps if you are HIV positive. If you are HIV positive, then we're gonna ask for other stuff. And that's one of the things that is a little star on the corner, right? And I included the two most common, but HIV is another one. If you have any other medical conditions, we may ask for another specialist clearance, not only your primary care clearance, but another one. So in an HIV case, I may ask you for an infectology or the doctor that manages your HIV to give a clearance specifically about that, and I'm gonna ask for a viral load and CD4 count, right? So depending on the other conditions that you have, you may need more tests. This is the baseline if you don't have any medical conditions, okay? And a quantitative HCG. Pregnancy test, I need the number, okay? It's not positive or negative. We are gonna do a qualitative one here in the office the day of surgery, which is a urine test. And that one's positive or negative, but I do need a quantitative, a number one before coming in. And like I mentioned, these are the two most common ones. If you are a diabetic, I'm gonna ask for a hemoglobin and A1C. It needs to be less than 6 for you to qualify for surgery. A thyroid test if you are hypo or hyperthyroid, and that includes TSH, T3, and T4. If you're diabetic or thyroid, I'm gonna need a clearance from your endocrinologist. If you are older than 50, I'm gonna need a cardiology clearance, okay? So there are other tests depending on age and medical conditions. EKG is for everyone. I need a baseline electrocardiogram that tells me your rhythm, heart rhythm in different leads, which means different phases of the heart. Why is this so important? Because the anesthesia medications can cause arrhythmias. Lidocaine, which is a numbing medication, can cause arrhythmias. So we need to check your baseline EKG and have it available with us just to make sure that it's nothing baseline. And if something happens, we need a comparison in your chart, okay? So this one is extremely important, and it's not one, this is a 12 lead EKG. If you go to your primary care, they can do a 12 lead EKG, okay? X-ray, chest X-ray, not for everyone. If you're above 40 or you're a smoker or have history of asthma, then you need it regardless of your age. If you're not a smoker, if you don't have history of asthma, then if you're 40 or older, you need to get the chest X-ray. And mammogram or ultrasound, you're getting a breast procedure. Mommy Makeover is a breast procedure with a tummy tuck. And you're over 40, you need to do a mammogram and ultrasound before the surgery. If you have breast cancer in the family, for example, a first-degree relative, what does that mean? Your mom, your sister, and they were diagnosed before age 40, then you should be doing your mammogram and ultrasound 10 years before they were diagnosed, okay? For example, if your mother had breast cancer when she was 30, you should be starting your screening for breast cancer at age 20, okay? You usually see everywhere at 40, but that is a very, very important thing for people with family members with breast cancer, first-line family members. We're not talking about your grandma or your aunt or cousin, first-degree relatives, okay? Sister, mother, okay? And that's pretty much it. When do you submit all of this? At least 2 weeks before surgery, okay? And that is why before the 60 days, you should be making all of these appointments, especially if you need a specialist. If you're above 50 and you need a cardiologist, cardiologists are usually booked out for months, okay? So plan ahead, get your appointment. Most of them will ask you for the blood work to clear you, okay? So try to get the blood work before, have that clearance after, because 2 weeks is the deadline to submit everything. And he's like, why don't you allow me to submit everything later? Well, when you submit all of that, I have to go and review all of this and make sure that everything is under our standards and you're cleared. Then I give it to anesthesia. Anesthesia checks everything up, clears you as well. So it takes a couple of days for us to do that. We try to do it as fast as possible because I know it's stressful, right? You're waiting. I like, should I need to book another flight? Do I need to cancel? I know it is stressful, but we are trying to keep you safe, and that is my number one priority, right? Hotels, flights, massages, scheduling, that is all after I make sure you're safe. I am not going to compromise your safety because any of this is wrong. I'm not going to compromise it just because you're going to have flight problems or hotel problems. That's not my priority. My priority is that this is good so you can safely go back home and we don't have any complications after the surgery, okay? So 2 weeks before, usually in a day or two, we let you know that if you're clear or not for surgery or if you need to do anything else, okay? Other thing that I didn't mention here is for patients with autoimmune conditions like rheumatoid arthritis, lupus, those cases, I get a lot of questions about that. The bottom line is, if you are in an immune suppressor medication, the majority of RA and lupus are treated with immune medications, immune modulators. If you're one of those, you can't have surgery here because that blocks your wound healing. So the risk of having wound openings and having infections and complications from the surgery is very high. Actually, one of the contraindications to putting implants on a patient is autoimmune conditions. So you are not even a candidate for breast implants, okay? But if you're ANA positive, for example, but you're not diagnosed with any autoimmune condition, you do not take any medications, and your symptoms are very mild, we can't consider your case, but you need a rheumatology clearance, okay? You need to go to a specialist, and they need to document that you are okay to proceed with general anesthesia and the surgery, okay? So that's the only caveat there. I think I went over the majority of the clearances and the special considerations. But if you have any questions specifically with that, I can take it now, or any other questions?
I have a few questions here.
Okay.
If I have a small cyst close to my areola, it's been the same size for 3 years. Do I have to take that before surgery?
No, so that it's included in the mammogram and ultrasound, right? The mammogram and ultrasound will say a couple things. So there is stratification for mammograms and ultrasounds that's called BI-RADS. BI-RADS is what the radiologist tells us if it's malignant, suspicious, benign. So if you have a cyst that has been there for forever, it's probably a BI-RADS 2, which means it is a benign. If it's a BI-RADS 2, we're good to proceed. A BI-RADS 0 is we don't have enough information, they have to repeat something, either repeat an ultrasound with more views, get an MRI, something else. 0, it's no good for surgery. BI-RADS 1 is you don't have anything, you're cleared. It's very rare that you have a BI-RADS 1. It's usually very young patients. I don't think I've ever had a BI-RADS 1. It's like your breasts are completely clean, you're good. Usually you have a BI-RADS 2. BI-RADS 2 is you have cysts, you have a little lump, but it looks benign, nothing to do, follow up with your yearly ultrasound mammogram. If you're a BI-RADS 2, we're good to proceed. BI-RADS 3 is, it's probably benign, but we should keep an eye on it. Depends on the type of eye on it that they want or the radiologist recommends. If it's something that has been there, we just need to monitor it in 6 months, I will give you the recommendation of adding a pathology quote in your breast procedure. What does that mean? That whatever I take out in the surgery, we send it to pathology. Take a look in the microscope and see that everything is okay. If it's a BI-RADS 3, but we should do a biopsy, for example, it's usually a BI-RADS 4, but depends. That you need to do before the surgery. Okay, BI-RADS 4, 5, and 6 are no good because that's the suspicions for malignancy. We need to take care of that right away. We need to postpone your mommy makeover. Okay, but a BI-RADS 2 to 3, we can work on it.
If you had a recent echocardiogram, does that take the place of the EKG?
So an echocardiogram is an ultrasound of the heart. It does not look at the same stuff that an EKG does, okay? EKG looks at the rhythm, so it's more for arrhythmias, for the rhythm of the heart. The echo, if you are over 50 and you visit a cardiologist or you have any medical conditions, they'll ask you to do an echocardiogram. But that is more of an ultrasound of the heart that checks the valves, checks how much it's filling, how much is pumping the blood, so it's different, okay? You will still need the EKG.
Okay, next question. After Lipo 360, for how long you should wear the faja and how many hours?
So after a Lipo 360, BBL, after a body makeover, the majority of body procedures, you're gonna be in compression for 6 weeks at all times. So you're just gonna remove the faja for showering, massages, but the rest of the time you should have it on. And then from 6 weeks to 3 months, 12 hours a day. After 3 months, it's up to you if you wanna throw it in the fire or continue to wear it sometimes.
Usually they want to keep using it.
I mean, I've seen both. It's like, I hate this, I don't want to see it again, or it's like, I feel more comfortable in it, I'm going to continue to wear it. So it's up to you.
Can you explain the timeline to use foams and boards after Lipo 360?
Good question. So foams are soft. They're there to protect your skin. You start wearing foams the next day, okay? So first 24 hours, no compression, let the skin heal. At 24 hours, you get your first massage, and then you put the foams and the faja on. The boards are hard. It's for stability. They give more compression. So you're gonna wait to switch or to add boards after you switch to a stage 2 faja, which is usually 1 week, 7 to 10 days out, okay? So foams the next day, boards, stage 2 faja, 7 to 10 days out from surgery. And the boards and foam for 6 weeks at all times. After 6 weeks, you can stop the boards, foams, and just the faja for 12 hours a day.
That makes me an idea.
Yeah.
I'm gonna start creating timelines in
Okay.
our Instagram account so they can
Yeah, that's a good
remind
idea.
me.
Yeah.
Okay.
That's a good idea.
Okay, another question. ¿A cuánto tiempo uno se puede volver a operar después de una liposcultura en noviembre?
Perfecto. So, después, si la cirugía es en noviembre, todo va a depender de qué otra cirugía estás pensando. Si es otra cirugía de liposucción lo que estás interesada en hacer, hay que esperar por lo menos 9 meses a 1 año, ¿ok? Si es una cirugía que no está, por ejemplo, si te hiciste liposucción del torso y ahora te quieres hacer los senos, pues 3 a 4 meses después de la cirugía. Todo va a depender si es la misma área de donde fue la liposucción, hay que esperar más tiempo, porque hay mucho tejido de cicatriz que se forma con la liposucción que hay que esperar a que eso baje para poder reoperar en la misma área. Pero si es en otra área, 3 a 4 meses.
Okay. How does the drain screw work? How does the drain screw work?
So very easy. The drains are little plastic tube, and on my live last week, I even had a drain with me, and I showed how to empty it, how to open it, how to milk it. So if you just check, go to my last week Tuesday tips, fast forward to when you see me playing with the drain, and just take a look at that part. I go over specifically about how to open it. It's literally just emptying it and milking it, which is trying to get the clots out of the little tube. But don't do it too often. Do it like twice a day the first few days, and then just once a day, and it should be enough.
Okay. A lot of questions. How far can we be staying from the clinic?
Okay, so I recommend between 10 to 20 minutes away, really, because Miami traffic is insane. So one of the things that is hard to understand, and it happened to me when I moved to Miami, anywhere else in this country you set 20 miles away and it's roughly 20-25 minutes. In Miami, you set 20 miles away and it can take you an hour. Traffic here is insane. So I recommend it's like a very short radius, 5-10 miles from here, okay? So that it'll take you from at least 15, max 30 minutes. Usually after 30 minutes, you're gonna be uncomfortable in the car, especially those first few days. If you need to come and go because we need to see you more often, then it's better just to be close by.
What's the BMI I need to have to do a BBL?
Max BMI is 33.5. Max BMI. I recommend less than 30 for optimal results and less complications.
Okay. No, the thing is, she's too thin.
What?
Yeah, so the lowest BMI, not the max.
Oh, the lowest. The
Yeah.
lowest BMI for BBL, around 21. I want fat, okay? So if your BMI is less than 20, you won't have a lot. Probably you won't even have a liter of fat. To actually see a difference in the buttock volume and to fill, even if it's a skinny BBL, to kind of fill the hip dips, I need at least 600, 700 per side to try to get something. So at least 2 liters to work with. So around 21, 22 BMI is ideal.
Okay, when doing a mommy makeover, what procedure do you start first? Breast or tummy tuck?
Interesting question. I would start with the breast first, okay? With the tummy, I need to sit you, and then it's uncomfortable to put implants when you're sitting up, okay? So I start with the breast. When everything is almost done, then I sit you, make sure that everything looks good, and finish the tummy tuck with you sitting up.
What treatments help flatten and lighten hypertrophic scars?
So hypertrophic scars can be a challenge. There are different options to treat that, including an early scar treatment with silicone-based scar products, injectables such as steroids or 5-FU, which are medications that you can inject directly on the scar to soften the scar. And in the more long-term effect, lasers are very, very good for resurfacing, decreasing the thickness, and improving the color.
And we have Morpheus 8 and IPL.
Correct. So here we are treating our hypertrophic scars with a combination of IPL laser, which is very good for the pigmentation or the color of the scar, combined with Morpheus 8 treatment, which is microneedling combined with radio frequency, and that is actually being great for the color, texture, and appearance of the scars.
This is a comment. I'm so excited. See you soon, Dr. V. Yesi.
That's awesome. I'll see you soon. I'm super excited for you. Okay, so thank you so much, you guys, for joining. Hope this kind of helps create a better structure of those 3 months before your surgery, to kind of plan that in 3 months you should be planning for the appointments to try to get everything done within 60 days so you're good and cleared 2 weeks before surgery. Remember to prioritize your health with a good exercise routine, a healthy diet. Prioritize your proteins. Proteins are great for healing, so you need those for your mommy makeover. And for those scars to be super thin and beautiful, I need those proteins to be high and healthy, okay? So thank you so much. I'll see you guys next week on Tuesday Tips. Peace out.